In tonight's Health Watch, pediatric brain tumors are being studied like never before.
They are being looked at in a petri dish with an actual miniature human brain. CBS 2's Dr. Max Gomez has this story.
It sounds like something only a mad scientist would think of, growing mini brains in a petri dish. But it's actually cutting-edge research at this Weill Cornell medicine lab that hopes to ultimately cure pediatric brain tumors, the kind of cancer that took the life of Dr. Mason Kamen's son, Lance.
Is the most common solid pediatric brain tumor, and it's the leading cause of cancer death among children and adolescents.
But despite decades of research, there's been little progress in treating the disease.
When I started out in this field 32 years ago, the average survival for a patient with a glioblastoma was 12 months. It's now 15 months.
So both doctors joined forces and decided to take an unusual path. They used small pieces of normal brain taken during surgery to remove the tumor and actually grew miniature brains or organoids in a petri dish. Then doctors inserted a piece of the same patient's tumor into the little brain organoid so it would grow and invade the normal brain tissue as it would in the human body. Then comes the treatment part. In a custom robotics lab, hundreds of thousands of drugs and treatments are tested on each brain organoid automatically, essentially tailoring a potential treatment to each individual patient's brain tumor combo, tremendously speeding up the process of finding out what works and what doesn't.
We definitely hope to prolong survival and improve quality of life. I think that's essential. To ask for a cure right away, I think it's a little bit unrealistic. It will take time.
Now, this brain in a dish is actually part of a trend in treating cancer and other diseases. Whether it's brain, liver, or some other vital organ, growing a patient's own tissue in a dish allows researchers to figure out exactly what treatments may or may not work. That's because every patient's tissue is different. So you really have to, even the exact same treatment, two different diseases may work on one and not on the other. So they've really got to figure it out that way.
That's incredible stuff.
Isn't that amazing?
Yes,
wow,
it is.
Cool.
Thank you, Dr.
Thank
Max.
you.